Hello, everyone. Jen Rumbelski from the La Crosse County Health Department. Glad to be with you today. It is Friday, May 15th. We're halfway through the month of May, and it is speeding by. So we're glad to be with you today. And as always, I will start with the updates on case information. So in La Crosse County, as of right now, we currently have 44 cases. We have not had any new cases come in today. We have 3,067 negative test results for our county, which puts us at a 1.4% positive to total case or total test results. So of the total that we have tested in our county, 1.4% have been positive. We have 2 that are hospitalized at the present moment and 0 deaths. We also have 32 who have recovered, which means that we are working with 12 active cases. In the state of Wisconsin, there definitely has been more testing happening across the state. We can see that by the numbers. So the total number of positive test results for Wisconsin residents is 11,685. That is an increase from yesterday of 410 positive cases. Our total negative cases or negative test results are 128,657. That is an increase of 6,059 tests from yesterday. We also have 1,977 who have required hospitalization. That is an increase of 38 from yesterday. And we have 444 deaths in our state. That is an increase of 11 from yesterday. So the total percentage of positive to total testing in all is 8.3% for the state of Wisconsin, but over the last day was 6.3%, which means that the 410 positive cases out of the total of the positive plus negative test results. So at this time, I would like to invite our guest speaker to talk today. We are having Tim Cabot, who is the mayor of the city of La Crosse. And unfortunately, we won't be able to see Tim today. Our technology is not allowing for that to occur. But we have Tim on the line, and he will speak to us about a number of things. So thanks, Tim, for being part of our webinar here today.
Tumultuous couple of days with the Supreme Court's overturn of the safer at home order and really going from safer at home to no limits whatsoever. Regarding the order, as you might imagine, I've received numerous calls and emails and social media messages asking me to declare our own order for the city of La Crosse. And given these requests, I would like to just clarify the city's authority on these types of orders. I know that several areas around the state have instituted their own safer at home health order or some version of that. In our case, the city of La Crosse does not have our own health department or scientific expertise in these matters. We rely on the great knowledge and expertise of our La Crosse County Health Department and have been working with the health department very closely throughout the pandemic these past 2 months. In anticipating the Supreme Court's ruling, I did strongly encourage the health department to extend the safer at home order or to institute a new updated order, but obviously that did not happen. So we move forward, though, still in solidarity with our partners, and we strongly encourage our residents and businesses to keep up all of the good health practices that we have been doing these past 2 months. We encourage people to stay home if they're sick or have COVID-19 symptoms. We ask people to limit travel out of the area, that they keep practicing the good social distancing and good hygiene, and to wear a face covering if people are out in public, especially in places where social distancing is difficult. I do, and the city supports the county's statement of unity, and even with or without an order, we can still follow the health guidelines and work to limit exposure of COVID-19. At the city, I just would like to provide a few updates on how we are working on a number of fronts to keep people safe and healthy. Back in mid-March, we started our Emergency Operations Center, and will continue this for the foreseeable future. The EOC allows for critical communications and a focus on government operations while also responding to and preparing for any type of public health emergency. The city does a recorded briefing every Monday and Thursday morning at 8 a.m. to provide updates on our planning, our operations and logistics, and community members are welcome to view these briefings on the city's webpage. Our challenges here in the city are like everywhere else. We need to do more testing and see more testing here in the La Crosse area. We support the health department's efforts to get the National Guard and the testing operation at the Omni Center, and we are working with the county health department to secure an additional testing site somewhere near or around City Hall. I feel strongly that we haven't had enough testing here, and I want our community members to know that we are all working hard to advocate and to see more testing here of our residents and community members. We are also working to secure more personal protective equipment for our staff and first responders, including masks and safety glasses, face shields, gloves, thermometers, hand sanitizers, and the like. We'll continue these efforts really through the rest of this year at a minimum, because I know we're all planning for and preparing for more cases through the fall and winter months. We are doing everything we can with our critical staff and our first responders, especially to keep them safe, so that we don't see a company or a shift of firefighters or police officers have to go into quarantine. As you can imagine, losing a shift of these workers would be bad, to say the least. We have established a special task force to develop guidelines for large gatherings and special events in the city, including things like our festivals, parades, concerts, and tournaments. The city of La Crosse does require a special event permit for groups to hold these gatherings. And this task force is reviewing the plans for these events, and we will be in close consultation with the county health department to make decisions on whether to grant any permits for these types of activities through the summer and fall as we get more information. The residents may notice this weekend and for the next couple of weekends that the college students are moving out and moving around. We suggest that our residents and people just avoid the high traffic areas, especially around the campus area, because we're going to see more people out in our community. Please protect yourself and go to the county's health department website for more information and guidance. Finally, I would like to just share a few updates on city services and programs. Our critical services remain in good standing and performance, and we haven't really missed a beat, even with our split shifts, work from home, our flex schedules, and doing things a bit differently because of the precautions that we're taking. And I really feel that this is a testament to our incredible city staff. Our police officers are still out there responding to calls and catching the bad guys. Our firefighters are out there responding to medical emergencies and putting out fires. Our code officers are out there writing up orders for building violations. Our streets and utility workers are maintaining and upgrading our streets and water and sewer lines. Our contractors are still picking up trash and recycling. Our bus drivers are still providing essential transportation. Just recently, our libraries opened with curbside service, and I've heard that this is going very well. Our parks and trails are open and available as long as people continue to practice social distancing. Our playgrounds, pools, and splash pads remain closed. We've planted victory gardens here throughout the city in the last couple of weeks and have provided more than $530,000 in small business relief grants to our local businesses. And our partners, we continue working to find shelter and permanent housing for our homeless citizens. Our city hall and community centers remain closed to the public. Our goal is to begin reopening some of these facilities within the next few weeks. Residents may see some changes like physical screens and separation at our customer service counters. And I would ask our public to remain patient and understanding, as these changes are intended to keep us safe and to limit exposure of the coronavirus. We continue live streaming our committee and council meetings. We still are, though, providing opportunities for public input and engagement. We've been using a combination of these remote meetings, phone calls, emails, and allowing for small groups of citizens to voice their concerns in person. These efforts will continue for the next weeks and months as we assess our operations and work to reopen safely. And I would encourage anyone with questions or looking for more information to go to the city's website at cityoflacrosse.org, or you can call 789-CITY, that's 789-CITY for information. In closing, again, I want to thank the Health Department for the opportunity to share these updates and encourage all of our residents and businesses to keep up our great efforts at social distancing, at good hygiene, and especially in looking out for each other. So stay strong, La Crosse, and I want to thank you and would be happy to turn it back over to Jen and answer any questions or respond to comments.
Thank you so much, Mayor Cabot. And I speak for many, but certainly from me in particular, I just want to say how grateful we are for all of our partnerships, and you guys at the City of La Crosse have been fantastic partners, and we can't do it without you. And it does take a team. So very much appreciate all that you guys are doing. In addition, when you talk about testing, I think this might be a good time for me to say, yes, we certainly are. We have a testing site coming in next Thursday from the National Guard. We are also actively working to develop another application for a testing site to occur in the city of La Crosse. So we're really grateful for that partnership. That testing site, so some details in this press release is going out today, may already have been released. That site will be next Thursday, May 21st from 11 to 7. It will be a drive-through site. And we are looking in particular for any individual 5 and older who has any of the symptoms listed in the press release. So let's see if I can pull up those symptoms lists so that I can tell you what those are. So in particular, anyone who is experiencing fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss of taste or smell. So any of those symptoms, no matter how mild, again, many people who are infected start out with having no or very, very mild symptoms where they just think it's allergies or congestion. So any symptoms at all, you would be eligible to come to this testing site, and we would encourage you to do so. The swab or the nasal swab is what will be used at the testing site. So it is not the nasopharyngeal swab. It is intended for La Crosse County residents. We do want to let you know it is free, so you will not be charged for the test. However, it is first come, first serve. We only have so many test kits. It's the maximum number that they can do in an 8-hour shift. And if there should be a line, I think there might be a line depending upon what time you come during the 11 to 7 event. Bring a book or something else that you can do in your car for entertainment, particularly if you have children, having some kind of video or books or something for them to do in the car to keep them occupied. And again, anyone with symptoms. After you get tested, please know that we will ask you to stay at home, basically isolating yourself in your house, which is what we are recommending for the most part anyways. So the difference here would be we don't want you to go out and get any groceries or anything else, because again, if you're coming to this site, it's because you have some sort of symptom, even if it's mild. So we want you to wait until you get the results of the test before you go out and potentially expose others. So please have all the things that you might need for a couple of days to be in your home before you go to the testing site. So once you get tested, we will ask you to stay at home in isolation until you get those results. You will hear from either the National Guard if your test result is negative, or from the health department staff if your test result is positive. And just know that this is a moment in time. So this doesn't mean if you get a negative test result, for example, it doesn't mean that you go into the community a little later and you get exposed, that you could still come down with it later. Those exposures are ongoing in our community, but it is a moment in time. It is important to understand if you have symptoms, if you have COVID-19 or not. So I think it is a very important event, and we encourage anyone with symptoms of any kind to come, of the ones that I mentioned, but any mildness level, to come to the site. And again, this is one of the several steps in terms of increasing testing, just like Mayor Cabot talked about. So next, I wanted to talk a little bit about one of the biggest questions that we're receiving right now. And I want to acknowledge that many of you, though you do support the statement of unity and the call to action that I gave out yesterday, many are asking why we did not issue an order. So I want to directly address that question. And again, there are a lot of considerations that go into the order. So I want to share a couple of those considerations to help you understand that this is not just because we haven't done an order right now doesn't mean we aren't going to do an order. It means that at this point in time, we don't believe that an order is the best action. That could change, and an order is not off the table. So some of the considerations, first and foremost, is the need. And I talked yesterday about the data, and the data certainly indicates the need is there from that perspective. In addition, I think what goes into this is the level of non-compliance. So because we know that a certain level of non-compliance raises the risk in our community. So, just yesterday I gave this statement. We have seen a number of things happening on Facebook, in the paper, in the news, and just visually seeing things that show us that non-compliance is happening. And I urge you to follow the recommendations that we have provided, because that will result in additional evidence that we may need to have an order in place as opposed to not having an order. So the need is the first consideration. The second consideration is authority. And there are a couple of things that go into this. One being the health officer's authority under Statute 252. Another being local ordinances. So for example, La Crosse County has a health code, which is Chapter 11 of our ordinances for La Crosse County. And that is the code that I operate underneath whenever we need to enforce something. So there are a couple of different options for authority. Third, the content, and this one is really important. We would not just adopt the entire Safer at Home order that the state had. That isn't necessarily the best action for La Crosse County. So we want to use local data, and we want to understand and then use content in this order that would be specific to La Crosse County. So for example, if as we are recommending that you not gather in groups, one of the recommendations is to minimize close physical contact with those outside of your household. Another one is to minimize congregating in groups of any size. If we see, particularly at businesses or in the community, if we see congregating occurring, despite the recommendations that are out there, this tells us that the increase is there for the spread of this virus in our community. And as we get more cases, that increased risk continues to be of concern for us. So those are some of the things that we think about in terms of what the content would be. Would the order, for example, just specifically speak to asking or basically ordering folks to follow the guidance that I've already identified without an order? So the order could say you must follow the Wisconsin Economic Development Corporation guidance. You must follow, the guidance that I've laid out in my statement already. It may also be more restrictive in terms of the number of individuals that can congregate, particularly in mass gatherings. And then we need to decide what is the best number to put out there. I've seen everything from 25 and 50 and different numbers. So being very specific and intentional about what number is best to reduce the risk for the spread of the disease. Then we also consider the enforcement side of an order. If you have an order, then you need to enforce that order. And what we are learning and hearing about through channels with regards to the Supreme Court decision and what the authority may allow, we don't yet know if law enforcement can enforce an order, if it would just be through the ordinance that the county health department has. Then that would be forfeiture in civil court. Um, and in addition, I think that there are always unintended consequences to not doing an order, to doing an order, to what you put in the order. And so these are things that I can tell you every hour of every waking moment of the day I am thinking about and talking with experts, speaking with our municipal leaders like Mayor Cabot, talking with others who understand the legal aspect of this, being advised. I'm gathering evidence. So this is not, this is not a simple process. It needs to be done well, and to do it well requires being really intentional about what we put in the order and how we put it in there, and how we enforce it. So I felt like it might be helpful for others to understand all that goes into an order, because it is not just a simple process. So I wanted to be really clear about that. In addition, I do want to just indicate there are some in our community that believe, because we are not under an order, that there is not a risk. I think that if you watched the media briefing yesterday, it would be very clear to you that we certainly have risk in La Crosse County. It is not likely as high as areas like Brown County or others, other areas of other states even, but there is definitely a risk. And we have had 9 new cases this week already. And, out of a total of 44, that's a pretty significant percentage of increase, as I talked about yesterday. So there is definitely risk. And the fact that we have an order does not tell us whether there is risk or not. We use the data to tell us that. So I want you to clearly understand there is certainly risk. We are doing everything we can to minimize that risk. And that, again, might mean an order at some point in the future. So at this point, I just want to reiterate all of the actions that I have made in the call to action, because they are evidence-based and they will reduce the risk for our community. And these have to be followed by all businesses, all events, all individuals in our community, every single person in this community. And if it's not, every person who doesn't follow the guidelines and recommendations can have a negative impact on the whole. And so, this is where we really have to work together, and we have to come together in a unified fashion to help decrease the risk, not just for ourselves, but for others. I realize that there are individuals that cannot see this virus and therefore it is not real to them. But I can tell you it is likely just a matter of time before you know someone or even yourself may be infected with this virus. Hopefully it will not be a moderate or severe infection, but we never know. And so the best course of action is always prevention, trying to reduce any individual from getting the disease in the first place. So I reiterate that all residents of La Crosse County, including businesses, customers, visitors to La Crosse County, should do the following. Number 1, they should stay at home if they are sick. Number 2, minimize close physical contact with those outside of your household. Number 3, minimize travel, especially to areas considered viral hotspots, both within our state and beyond our state borders. As I mentioned yesterday, despite what orders other states have, the risk is also present in other states. And we've looked at the projections, and the projections for death related to COVID-19 is higher in every state around us. So if we are traveling back and forth, we are increasing that risk. Number 4, wear a fabric face covering if you must be in public. And I've talked about why that is. It is because you may be infected and not know it. I truly believe that no one would infect someone else on purpose. And if that is, I just really don't think that we do that on purpose. And so what it means is that we might be infected and spread it to others before we know it. None of us want to do that. So the fabric face covering can assure that that does not occur. Number 5, maintain 6-foot distances with others whenever possible. Again, that's because of the way that the virus spreads through droplets, especially when we're talking, coughing, sneezing, singing, or otherwise. Number 6, minimize congregating in groups of any size. Number 7, wash your hands frequently with soap and water. And number 8, avoid touching your face. Again, these are all actions that will help reduce the spread of COVID-19 in our community, along with the challenges, including disease and death that can come with that virus. We are in a fight against this virus, and we must work together in order to be a united front and not allow this virus to win. So I do just want to reiterate, there is risk. We have community spread in our county. And we do not and cannot use the fact that we don't have an order at the present moment to change that we know what we need to do. And an order doesn't need to be in place for us to know what to do. So at that, I will then open it up for questions.
Travis here from WXOW. This question is for Mayor Cabot. Just wondering how this pandemic has sort of affected the bottom line at City Hall with, everything being canceled and such.
Thank you. Well, there's been a lot of impacts, obviously, and from bottom line, whether it's our programs and participation in those to our budget. That's one of the issues, obviously, that all local governments are going to try to deal with, is the significant, hole in the budget that the coronavirus has caused because of the closures and the, for example, the lacrosse center, cancellations of events and bookings there. We're trying to understand what the state of Wisconsin might do with shared revenue and with state aid. So, I mean, as we're sitting here today, we're projecting about a $6 million gap in our $68 million budget. And since most of our budget is personnel cost, we are going to have impacts to staff, but we're working through to try to minimize those as much as possible and to really identify our critical and essential services and to maintain those if we possibly can. We're not only, looking at this year, obviously, but next year as well, because of, having the virus still be in our communities really through this year and probably into next year before any type of a vaccine is available.
Go ahead, Travis.
Question for Jen. We're hearing reports that a handful of bars downtown are going to be opening up this weekend. Just your reaction to that.
My reaction is that a business can be open right now, but that they must do so safely in order to protect not only those that work at that business, whether it's a bar or somewhere else, but also those that attend that business and are going there for the reasons for which that business is open in the first place. So I would urge all businesses, including bars, to protect those that are attending their location by abiding by the recommendations. And I know that can be difficult in locations like that, but congregating is going to spread this virus. We know that. So if they are allowing that to occur, despite the recommendations, that will be part of the evidence that I use to determine next steps. So I think it's really important that businesses be open safely. And if they cannot be open safely, they should not be open.
Justin with WKBT. I was kind of curious, I guess, what kind of threshold or numbers would you kind of look at in terms of considering putting in some of those or imposing some of the safer at home kind of esque orders that the governor has in terms of number of infections and whatnot?
Thanks, Justin. So right now, I can definitely say that if I wrote an order today, it would include that businesses and all in our community need to follow the guidelines, and that would include the guidelines through the Wisconsin Economic Development Corporation. I also feel very strongly about mass gatherings, and I've seen a number of a bunch of different numbers as I've mentioned. Right now, my number would likely be somewhere between 25 and 50 in any given location. And again, that is only if the 6 foot distance guideline can be followed, because we just cannot have where 50 people are in a location. They're close together, which is perfect for the spread of this virus. One person gets sick, we interview that person, and they have 50 potential contacts. That is devastating to our community. It is very difficult for my staff who do that work. We just do not have that much capacity to contact 50 people in a short time frame. So there are a lot of things to consider there, and we rely right now on our businesses and our community members to do the right thing. You know what to do, and we need you to do the right thing.
Jen, we have a question from the La Crosse Tribune, and they're asking what other area officials did the La Crosse County Health Department hear from other than the mayor about whether to extend a local safer at home rule, and who at the county had the final decision about not enacting a countywide order?
Sure. So in terms of my advisement team, and I would say anyone who I've reached out to and asked for information on what we should do next. And that isn't just with this order, but it does include this order. And I reached out to all many of the significant law enforcement officers in the county, as well as municipal leaders. I have spoken with many health officers around the state, our state association, the Wisconsin Association of Local Health Departments and Boards, others as well. And I would say that in terms of making the decision, because this is a health order that we're talking about and would be under my authority as the health officer through Chapter 252 of Wisconsin statutes, I am employed by La Crosse County. And I can tell you that my corporation counsel, I definitely need their support in order to take an action of this sort. So they are absolutely part of my decision-making team, as well as others who I trust in administration at the county. And again, it's a group of those that both advise me and would need to support a decision that I take into effect. So there are a number of individuals, and I really pride myself on getting a lot of information, the most that I can, to make the best decision at any given time. And in a situation like this, it's just one where there's no absolutely right decision. They all have, each decision on the table has potential unintended consequences, and capacity challenges, and a number of other things that I must consider. So it is a very difficult decision to make, and that is why I routinely, almost all day long, am considering and taking in the evidence and the information and talking to experts and being advised and advising others, to make sure that when we are doing the right thing, the best thing that we can at any given time for our residents.
Another question for the mayor here. There's been a lot of buzz about Oktoberfest, whether or not that should be canceled. What is your sort of take on if you think there should be an Oktoberfest here in the fall?
We will be meeting with the leadership of Oktoberfest. I believe it's coming up sometime in the middle of June, to understand what their plans and preparations are for the fest and the various parts of the fest, whether it's the parades or the music or whatnot. We're going to, as I had mentioned as a part of my remarks, we do have a small group, a task force that's made up of multiple departments that are reviewing the request for special events, and I've asked them to develop guidelines in consultation with the county health department so that we can do everything in our power to have these types of social gatherings happen and move forward safely. But between now and September, there can just be a lot of, there's a lot of change that could happen. So we're going to meet with them in June, encourage them to do the right thing in the plans and following the guidelines. And I'm sure as we get then closer to September, there will be further discussions and ultimately a decision.
Any other questions for Jen or Tim today? I'm not seeing any.
Okay, well, it is Friday, so our next time with you will be on Tuesday at 2:30. We are working on trying to have data for you, especially in regards to perhaps cases by next week at some point, so that you understand where we're at with cases, and I can show you additional information like I have in the past about the cases so far. And we certainly will continue to update you through the weekend as needed or until Tuesday. If something else comes up that we feel you need to be aware of, we'll use our social media channel as well as our COVID-19 website. And before I leave you today, I just cannot strongly enough reiterate the importance of following these guidelines. Please remember that we are in a fight against a virus, which is something we cannot see and is definitely spreading in our community. And we have the ability to work together to decrease the spread of this virus. We don't need an order to know what to do. And we know what to do. We just need to do those things. And so every individual in our community has the ability to take those guidelines and follow them. And we appreciate all of you who are already doing that. I'm aware of a pledge to stay at home. I appreciate those of you who take this seriously. And we have lives on the line in our county. That is a very serious situation, and we need to do everything we can to reduce the risk, and that takes every person in this community. So we appreciate all of you who are doing the right thing, and we urge those of you who are not, or who are wondering what to do, to educate yourself and make the right decision to protect yourself and others in our community. So with that, thank you so much, and we'll see you next Tuesday.